Welcome to the Explainer. In healthcare delivery, it's incredibly easy to just focus entirely on patient outcomes, right? Because obviously that is the primary goal. But here's the thing. To deliver truly world-class care, you absolutely need a healthy, safe, and supported workforce. Today, we're jumping right in and deconstructing exactly how the industry measures that safety.
Think about the striking irony at the heart of healthcare. The very people dedicating their lives to protecting our health, to healing our injuries, are themselves facing immense physical risks literally every single day, just because of the nature of the work. Moving patients, exposure to infectious diseases, handling sharp instruments. Because of all this, the healthcare delivery sector actually records some of the highest injury and illness rates of any industry out there. And when a facility has a high injury rate, it doesn't just mean it's a dangerous environment. It actively drives up workers' comp costs, it crushes employee morale, and it severely impacts staff retention.
So to manage this problem, you first have to measure it accurately, right? And you need to measure it in a way that lets you compare, say, a small hospital across town to a massive healthcare network across the country. That is exactly where the SASB standards come in. Under their framework for the healthcare delivery industry, specifically metric HCDY 320A.1, they use a standardized solution called the Total Recordable Incident Rate. You'll usually just hear it called TRIR. It is the absolute gold standard for tracking work-related injuries and illnesses. Okay, let's dive into this and look at our agenda. We're going to deconstruct this piece by piece. First, defining an incident. Second, the math behind TIR. Third, who actually counts in these populations. And fourth, the main takeaway. Section 1. Defining an incident and what exactly counts as an injury. Look, before we can calculate anything at all, we have to be absolutely precise about our variables. We can't just count every single paper cut. The SASB standard provides a highly specific severity threshold for what qualifies as a recordable incident. An event is recordable if it results in death, days away from work, restricted work, transferring to another job, loss of consciousness, or, and this is key, any medical treatment that goes beyond basic first aid. Plus, if a physician or licensed professional diagnoses a significant injury or illness, that counts as a recordable incident too, even if it doesn't result in immediate time off. It is absolutely crucial to draw a hard line between everyday bumps and true recordable events. First aid is defined merely as emergency care provided before regular medical aid happens. So, if a nurse gets a minor scratch, needs a bandage and a pat on the back, that's first aid. It does not hit the threshold. But if it requires treatment beyond that, it goes on the record for sure. Also, and this is to keep the data clean, an incident must be a completely new case. You literally cannot count a flare-up or an update to an old injury as a brand new incident. Now, you might be wondering, where do these incidents actually have to happen? Well, the definition of the work environment is surprisingly broad. It includes the physical locations of the establishment, obviously, but it also encompasses the equipment and materials the employee is using. Even more importantly, if an employee is traveling and gets injured, that absolutely counts as a work-related incident, as long as they were engaged in work activities for their employer at the time. Moving on to Section 2, the math behind TIR, and how we actually calculate the rate. Now, what's really interesting about this calculation is its anchor, the number 200,000. It's not just some random giant number pulled out of thin air to make the math look nice. 200,000 represents the exact total number of hours that 100 full-time workers would provide annually. That's assuming they work 40 hours a week for 50 weeks a year. This number? It's the great equalizer in safety metrics. So let's walk through how that 200,000 fits into the formula step by step. First, you take your statistic count, the total number of those recordable incidents we just defined. Second, you multiply that count by 200,000. And finally, you divide that result by the actual total number of hours worked by all employees in that year. By multiplying by 200,000, you're essentially asking, hey, if this facility had exactly 100 full-time employees, how many injuries would they have had? This perfectly standardizes the rate. It means an investor or regulator can look at a TIR of 3.5 at a tiny regional clinic and meaningfully compare it against a TIR of 3.5 at a massive hospital network. Section 3. Who counts? Let's talk about employee populations. As we all know, a formula is really only as good as the data you feed into it. And this brilliantly illustrates how comprehensive the reporting is under SASB, because healthcare entities must disclose the TIR for two distinct groups. First, direct employees. These are the individuals on the entity's payroll, full-time, part-time, seasonal, executives, the whole shebang. But they must also calculate the TIR for contract employees. These are folks not on the payroll, but whom the entity supervises or manages.
Think independent contractors or third-party staff from temp agencies. This is a real game changer. It ensures a hospital can't just artificially lower its injury rates by outsourcing its most hazardous jobs to a labor broker. If you manage their day-to-day work, their safety is 100% on your record.
Section 4. The takeaway and why all of this really matters. So, we've spent some time in the weeds here with formulas and classifications, but why does measuring this so precisely matter? Because, simply put, what gets measured gets managed. Proactive management of workforce health and safety is a massive value driver. By accurately tracking TIRR for both direct and contract employees, a facility can identify danger zones, implement targeted safety audits, and develop way better training protocols. Doing this successfully reduces workers' comp costs, it keeps highly skilled staff on the floor instead of on medical leave, it boosts morale, and it drastically improves employee retention in what is an incredibly competitive industry for talent.
So what does this all mean? The crucial point to take away from this explainer is this: the quality of patient care is directly tied to the well-being of the people providing it. If a healthcare delivery entity lacks the rigorous standards to measure and protect its own workforce's safety, how can anyone trust them to ensure the safety of their patients? Understanding TIR gives you the lens to see exactly how well an organization values human life, and that starts with its own people.